to have you all with us today on this bright and sunny day here in Baltimore, Maryland. And of course, you're listening to the Marc Steiner Show on WEAA 88.9 FM, the voice of the community. We're going to speak with labor activists and workers involved in many struggles around here, including people starting off the program who work at the Johns Hopkins Hospital. We are joined here in studio by Daniel Roberts, who's a transporter who's been working at Johns Hopkins a year and a half and makes $12.50 an hour as a member of SEIU Local 1199. Good to have you in the studio.
It's good to be here.
It's a storied union. Carrietta Hiers is with us in the studio. She's a longtime SEI 1199 organizer at the Johns Hopkins Hospital. She's been present at the ongoing contract talks between the workers in the hospital. Carrietta, good to have you here in the studio.
Thank you.
Your reputation precedes you. Good to have you here. Jeff Singer's in the studio. He's founder and former executive director of healthcare for the homeless and teaches now at the University of Maryland School of Social Work. And wrote this interesting piece, a letter actually, to the editor in the Baltimore Sun, outlining why Johns Hopkins could afford to pay their workers more. And he's here just to be able to throw all those facts on the table that he's been researching and talk about that. We did ask Hopkins to join us. They sent a statement instead and said they could not join us. And I wrote other people at Hopkins asking them to please bring people here, even if they want to do a one-on-one and not a debate with the workers, which was fine. But did not hear back from them about that either. So we did very, very hard try to reach out to the folks at Hopkins. They wrote here saying this. This is the official statement from their press people, then we'll launch into our conversation. Thanks to careful planning and hard work on the part of so many Johns Hopkins employees, we have been able to conduct business as usual at the hospital, focusing as we always do on providing world-class care to our patients and their families. The workers represented by the union are primarily maintenance and food service workers. There are approximately 2,000 of the nearly 20,000 people working at and providing services for the Johns Hopkins Hospital, which includes employees, medical staff, and trainees. These union represented employees, like all of our employees, are important members of the Johns Hopkins team. They do not provide direct clinical patient care, though they support all of our clinical areas and operations. We had a contingency staffing plans in place to assure no disruptions to our patients and their families would take place. We remain hopeful that continued good faith efforts toward negotiating will result in a contract that all parties feel is fair and equitable. That was sent by Kim Hopp, who is Director of Media Relations and Public Affairs at Johns Hopkins Medicine. So that's their statement. And I see at the end of our table, Carrietta Hiers is smiling. I'm curious what you're smiling about.
I'm actually smiling because of the statement. Our unit actually represents surgical techs, pharmacy techs, supply coordinators, instrument processors, or support associates, radiology transport, general transport, then maintenance of all the facilities, EVS, linen, and dietary.
All of that?
All of that.
Mm-hmm. So tell me about what's at the heart of this strike for both. You start with you, Carrietta, then I'm going to come over to Daniel, and hear his thoughts on what he does for a living and what it means to him. But talk about what's at the heart of this strike at the moment.
For us, the actual heart of this is raising what we call the floor level up. And that's when we're talking about our more senior workers who have been there for at least 15 years or more and who have yet to be able to make at least $15 an hour. Initially, folks were talking about, we have to change the multiplier on the pension, we have to do this. But there's no need in changing the multiplier on the pension if you're not making that hourly wage.
And you've been working at Hopkins for how long? Right now, Daniel?
A year and a half.
Tell me about your job. What's your job there?
I'm a general service patient transporter.
And what does that mean?
I transport patients back and forth through the hospital all over Johns Hopkins. Johns Hopkins Hospital is a pretty big campus.
Yeah.
I get asked on a daily basis how long how long did it take you to learn the Hopkins Hospital? And I also get asked how far do you walk a day? I think one day I had on a pedometer on my phone.
Yeah.
And it didn't tell me the miles, but it told me the steps. And just 6 hours I walked 39,000 steps.
Well, you must be in shape.
I like to think so.
But that's, I mean, all joking aside, I mean, that's a lot. And so your work actually is really direct patient service because you're working with and transporting patients across the hospital for various tests or whatever they have to do, right?
Yes. I transport beds, stretchers, wheelchairs. I even do ambulatory. I get to talk a lot with the patients and hear their story and actually listen to, how they feel. I try to give an encouraging word, throughout the day, to different patients that may be going into something that's very frightening. Sometimes you have some patients going into life-threatening surgeries.
Right.
And so, just to, provide them, with a quick word or some type of encouragement, to help them out.
I mean, I asked that question because I think it's important, Daniel Roberts, that the men and women who you represent, just with your voice, do similar work. I mean, is the humanity in your job, is the part of your job that's more than just pushing a patient or a bed across campus from one place to the other? It's the interaction you have that is part of medical care.
Very important.
Right?
Yes.
Now, I don't think I'm making too much of that because, I mean, you're
absolutely not.
I think not. I grew up in a medical family, and I understand how those things work.
Mm-hmm.
And so the question here, what Hopkins is saying also in the paper, I mean, the folks at Johns Hopkins were saying in the articles I wrote both in the Baltimore Sun and the Baltimore Brew, which cover this pretty intensely in different ways, they're saying that the pot of money is not there. They're offering step salaries coming up to what do they say? It's now $12. Maybe they'll go to $14. Mm-hmm. But that money in that particular part of Hopkins was not there. And Jeff Singer, you wrote a piece in the Sun that kind of takes that on a little bit.
Yes, I don't have access to any of the proprietary data at Johns Hopkins, but I know how to get on the internet and find their tax forms. It's called the 990. They do this filing. And according to their tax forms, right, Hopkins has both very large assets and a good deal of income. Nonprofits, and Hopkins is one, need to have more money at the end of the year than they started with, or else they'll go out of business. And in the Hopkins case, for their latest 990 on the internet, they had revenue over expenses of $84 million. Now, that's less than they had the year before and the year before that. The hospital business is a difficult one for sure. Nonetheless, $84 million would be about 28 times what they need to pay a decent wage to the folks that work there. Hopkins wouldn't be the #1 hospital in the U.S. without people like Carrietta and Daniel and the many other people I met while walking the picket line there. So these core employees deserve a living wage, and they're not getting a living wage.